My name's Sian and I'm one of the renal pharmacists at Manchester Royal Infirmary. We're here to chat to you about the medication changes you can expect after your transplant, your anti-rejection medicines and how we'll manage those changes with you. The renal pharmacy team at Manchester Royal Infirmary consists of 8 pharmacists, several pharmacy technicians and some medicines administration technicians. You'll meet us while you're on the ward as an inpatient and we'll also catch up with you in outpatient clinic. What can you expect from the pharmacy team when you're an inpatient? We will come and see you when you're admitted to get an up-to-date list of your regular medications. This helps us to make sure we can manage any medicines changes safely and we can inform you and your GP of all the changes that we make during your admission. We will review your medication on the ward every day and you might see us on the ward round with the doctors. After surgery, we might use some medications to control some post-operative symptoms, which might include pain relief, anti-sickness medicines and laxatives to control any constipation. We'll review your anti-rejection medicines every day, and these will be started as soon as you've got your new transplant organ. We'll also monitor any medications that you came into hospital on that need to continue. This might be insulin, anticoagulation or any antiplatelets that you're taking. And we will help you to understand your new medication regime before you go home. What changes can you expect to your medications after your transplant? When you've got your new organ, you may no longer require some of the medicines that you use for dialysis. These might include your phosphate binders, Renovit, Aranesp, and any other medicines that you use for dialysis. Sometimes it might be appropriate for us to stop all or some of your blood pressure medicines. If we do this, we'll monitor your blood pressure really carefully and we might introduce some again later on. Some medicines that we start after your transplant include your anti-rejection medicines. We will start these as soon as you've got your new organ and they will continue lifelong or for the life of the organ. We also need to consider your infection history and that of the donor, and so you might need to take some antibiotic, antiviral or anti-TB medicines for up to 6 months after your transplant. And like we mentioned earlier, you might need some laxatives, some pain relief or some anti-sickness medicines. It might feel like you're taking a lot of medicines at the beginning, but this will reduce significantly, particularly over the first 6 months. Your anti-rejection medicines. Sometimes your anti-rejection medicines might be called your immunosuppression. When you receive a transplanted organ, your body recognises that it isn't your own. Without any intervention, your body's immune system would attack it to damage or destroy it. This is a process called rejection. We use your anti-rejection medicines to suppress your immune system enough so that this doesn't happen. Your anti-rejection medicines will be supplied and managed by the hospital team rather than your GP, and you will take these medicines for the whole of the life of the transplant. Your anti-rejection medicines work for between 12 and 24 hours, so it's really important that you don't miss any doses. By reducing your body's immune system, they can reduce your body's ability to fight infections, and you may be more susceptible to some infections. When you come into hospital, we will teach you what signs and symptoms to look out for of infection, and you should inform your transplant team if you get any of these. We monitor the levels of some of the anti-rejection medicines in your blood to make sure that there's enough to prevent rejection, but not too much to cause unnecessary infection or side effects. And it's really important that you tell any other healthcare professionals about the anti-rejection medicines that you take, as some other medicines can interfere with your anti-rejection medicines. What can you expect from the pharmacy team as an outpatient? We will follow up with you 2 weeks after your discharge and we will keep following up with you for the life of your transplant. We will monitor your bloods after you come to clinic, and together with the doctors we will review the doses of your anti-rejection medicines and we may phone you at home if there are any changes. The renal pharmacy team will also provide prescriptions for your anti-rejection medicines to make sure you don't run out. You can come and see us in clinic at any time to discuss any problems or any queries that you have about your anti-rejection or your other medicines. We also have a dedicated renal pharmacy phone number for you to phone if you have any queries. In the meantime, there are some things you can do before you get your transplant. When you're admitted, make sure you bring with you all of your medicines and an up-to-date, accurate list of the medicines that you are taking. Let us know about how you take your medicines at home. For example, if you have your medicines in a blister pack, or if somebody else helped you with your medicines. This will help us to plan with you how we manage your medicine safely on discharge. Keep up to date with your vaccinations. Check with your GP to make sure you're getting your flu vaccine annually and your pneumococcal vaccine every 5 years. And if you'd like to speak to one of the pharmacy team before your transplant, you can get in touch with us through one of your transplant coordinators. Thank you.